Okay, so Amanda, I'm honestly just going to go through, do some general joint mobilizations on the foot and ankle here. When I'm doing this, I usually actually like to start just below the knee. Now, I don't know how in keeping with evidence this is, but I play on the side of caution. If I'm going to treat the foot and ankle, I want to treat the tibiofibular joints, the superior and inferior. So I tend to start by soft hand. I cup the back of the knee, just distal, just inferior to the popliteal fossa. And I'm going to move so my metatarsal phalangeal joints, the ball of my hand basically, sits just behind the proximal tib fib. And I'm going to slide off, hook it with my fingers, and let my thumb sit at the anterior fibular head or anterior fibula. How does that feel, Amanda? Any discomfort there? And if I do get any discomfort there, what I can do is put a bolster under her knee, soften that, kind of soften the joint a little bit, put in a bit more of a relaxed position, and continue the same. If there's still discomfort, I'll flatten out my hand more. So instead of using the pads of my fingers, I'll let my fingers kind of act as a rest and I'll traction. And this is just something I do when I'm prepping before foot and ankle work or before knee work. I like to start just above or below wherever I'm working at least. I'll hold this for anywhere from 10 to 30 seconds, depending on if there's any tension or tenderness. From there, I like to slide down, go down to the distal tib fib joint. And again, thumb on the front, thumb underneath, and I'm basically sandwiching the distal end of the fibula. Again, I'm going to slide my hand under the popliteal fossa and just move a little distal. And I want to let my metatarsal phalangeal joints kind of rest posterior to the top of the fibula here. I'm going to let my thumb find the anterior surface. And what I can do is now pull with my fingers until I feel myself almost hook that fibular head through that lateral gastroc. And I'm just going to gently glide the fibular head anterior, posterior. And this is just something I like to do anytime I'm going to be working on a foot and ankle. I don't know how necessarily important this is for everyone, but I like to play it safe and include the entire foot ankle complex if I'm working even midfoot or distal foot. And I'll do this for anywhere from 10 to 30 seconds while things soften up, calm down if there's any discomfort. So I might just bend the knee, I'll bolster the foot, bring it up into a bend, and I'll again hook that fibular head and just gently pull forward. Amanda, how's that feel? Now, is there any sensation of burning, pulling, stretching, anything like that? Pretty chill? Chill is good. We like chill. And from here, I'm just going to straighten that knee out. So after I worked at the proximal tib fib joint, I'll move down to the distal. And what I want to do is kind of let my thumb find the posterior lateral malleolus, my other thumb find the anterior lateral malleolus, and I'm just going to essentially create a bit of a glide here, a shear of the distal fibula at the mortise joint. Now, bear in mind, I mean, this is a fibrous joint. The proximal one's a synovial joint. So in theory, we should see more movement here than here. I don't know that that's always the case that I've seen. And it doesn't necessarily mean there's something wrong. It is something to consider, though. And what I tend to like to do is I'll use my shoulder and bolster the foot, and I'm going to really kind of press into the anterior distal tib fib. Again, I'm going to hook around the ankle with my hand, anterior tib fib, and I'm going to create a posterior glide while I challenge with dorsiflexion and eversion. I'm actually using my elbow at a closed back position, my shoulder locked off a little bit, and it lets me use my body weight to really save my hands. And my force is coming kind of into the ball of the foot here and the, dorsal longitudinal arch. I always screw up plantar and dorsal. How's that feel, Amanda? You okay there? Any pain, or is that kind of cool? Okay, good. And what I'm doing here is just kind of challenging a bit of combined movement through the ankle. Nothing's really specific here. Nothing is really trying to nail out, say, dorsiflexion or eversion. It's just general movement. And as I do this, as I move through these kind of circular movements, I can get a feel for where Amanda's ankle moves more and less easily. Plantar flexion, dorsiflexion, There's a bit less overall free range than I tend to think would be average necessarily. But for inversion, eversion, there's a lot of freedom of movement. It feels very, very fluid, very, very open and almost hypermobile, which would make me think there's a history of inversion injuries. And I would definitely want to ask about that. I'm going to come down the shin. I'm going to trap the distal tib fib joint and kind of lock off there with my hand. I'm not squeezing, I'm just stabilizing. And I'm going to use my other hand, basically gliding from my hand to find, as best as I can, the talus. And I'm just challenging talocrural movement, so movement of the talus in that mortise. And this is just a good little test for some inversion eversion at the talus. And I can slide a bit more distal to lock off the talus with my proximal hand and go subtalar. And we have a lot of freedom of movement here, which is, again, something that would make me think, okay, we have a history of inversion sprain or some hypermobility or maybe some previous injury to the lateral structures of the ankle. From here, I can just glide straight further down. I can go more subtalar with my proximal hand and more tarsal. And so I can now aim for a bit more of the mid-tarsal joints. Glide them, or I can add a bit more traction. And Amanda, I'm just going to kind of pull gently here. If there's any discomfort, let me know, okay? I'm going to load up. And I'm just going to pull and use my other hand to help create an inferior glide. How does that feel? Yeah. And all I'm trying to do is generally challenge tarsal and tarsal metatarsal joint movement. Basically, I'm going to landmark the proximal first ray. So I can find the first metatarsal pretty simply and glide up, or I can find the navicular tuberosity, come around the dorsal side of the foot, and then slide down. And either way, I'll find this tarsal metatarsal joint. And I want to use it as my fulcrum. I'm going to use the heel of my palm because that's nice and squishy and padded. And I'm going to push the heel of my palm gently on there while I kind of cantilever against the ball of the foot. And this allows me to challenge mid-tarsal glide. Now I'm getting a little bit of thumping there, and that's one of the tendons kind of bouncing off the edge of the bone. So I don't want to try to push on that same spot. So I've moved my hand placement over just because I don't want to irritate Amanda's foot. This is different for everyone. I don't really go too formulaic. I just kind of play and see what feels good. You okay there? Okay. And at this point, I'm just challenging essentially pronation, supination through the midfoot. So plantar flexion, or sorry, dorsiflexion of the midfoot, she's got plenty of movement. So I'm not going to go yarding on that anymore. What I want to do now is take that same hand position and challenge into a little bit of supination and a little bit of pronation. Especially the supination, I have this nice mechanical advantage that I can turn the whole foot. I can essentially superiorly rotate the cuboid and elevate the navicular, or I can do the same thing the other way. I just wrap my other hand around to give myself that same mechanical advantage, and I can push into the ball of the foot with my thumb. So I'm kind of creating this lever action here, and I'm pulling down on that navicular and on that proximal metatarsal to challenge a bit of pronation. And I'm just seeing what I have in terms of midfoot, plantar flexion, dorsiflexion, pronation, supination. From there, I like to move to the lateral side of the foot and really challenge essentially rotation of the cuboid. Now, again, we're not exactly isolating this movement. I'm more just moving it around, but it's one of those things that, say, post-ankle sprain or in people with plantar fasciitis, I'll often find as a tender area that softens up and feels really nice afterwards and can be really, really relieving to calm things down before you try to build them up with remedial exercises. So I'm going to let my foot kind of find that natural position at the talocrural joint and let my thumb fall down just posterior to the fifth metatarsal tuberosity. And I'm going to fall right off onto the cuboid by doing that. And all I want to do, same thing I did at the fibular head, I'm just going to take my two thumbs and do this gently. So find my cuboid, oppose it on the other side of the foot. I just challenge a bit of rotation. This can be a little point tender for people. So, Amanda, how you feeling there? Okay. So obviously Amanda has had her feet worked on before and is no stranger to having treatment there. Because if someone does this to me, I go through the bloody roof. That talocrural joint, I can use essentially the web of my hand, and it kind of finds this natural meeting point. And I let my thumb fall towards the cuboid. All I have to do is find the fifth metatarsal tuberosity, fall off of that, and I'm on cuboid. So I'm going to take my other thumb, oppose that through the foot, and all I'm doing is just challenging a bit of rotation through the cuboid bone. And this is going to be kind of a warm up before we get to a bit more navicular work. I've warmed all this up, then I'll get more into the more specific tendinous work, resistance, muscle energy techniques, and the like.